afternoon once more. I'm Moses Olungo Komojon. Moses Olungo Komojon is an expert in community health and development. And Moses Olunga John today want to discuss with the public on one of the non-communicable diseases which the public has requested me to highlight today. We can remember, for those who have not been with us for the last few days, last time we talked about one of the non-communicable disease, which is depression. And today we want to focus on what we call low libido. Low libido, we may not discuss low libido broadly, but what affects men also somehow affect women. So the low libido, which we want to talk about today, will maybe focusing on men. We get the data that, as per now, most clients, especially male clients, present themselves in the health facility, and the approximation of the clinicians who see these male clients reporting with low libido is estimated that out of 10 men in the public, about 6 feel inadequate. About 6 feel what we call low libido. So why can't we define low libido? Then we proceed from there. Low libido, according to me, is lacking the urge to have sexual relationship with an opposite sex partner. You feel disinterested, you lack the energy to have sexual intercourse with your partner. Low libido affects estimated 6 men out of 10. And this also depends on which category of men you are picked. We find there are a number of factors which precipitate low libido. And I've decided to categorize them into 4 categories to help me be clear in what I'm presenting today. One category of the cause of low libido is what I call psychological factors. The psychological factors in specific is one, anxiety. Anxiety in a layman language may be worries. One is worried, and the cause of worry may be many, and they are varied. There may be element of stress, psychological stress, and the causes of psychological stress may be many. There may be depression. Causes of depression are also many, the way we discussed last time. Somebody may feel low self-esteem. Somebody feel lack of confidence, and many other factors. The causes of this psychological problem, as we discussed last time, may be psychosocial pressure, and some are from the domestic. Some domestic psychosocial pressure and even physical pressure may precipitate one. If a couple has a disagreement, may precipitate this, and a number of factors. To limit myself to today's focus, I'll just leave that aspect of psychological or pressure or psychological factor as it is. 2, I can discuss about hormonal influence. Low hormone in an individual precipitate low libido. It is the hormone which is the energy in this aspect. Whatever precipitates low hormone in an individual is going to precipitate low libido. And this may be the few which I'm quoting right now, few factors which may precipitate low testosterone. One is wild environment. The wild environment is an environment which destroys the testosterone or which destroys what we call spermatozoa. When a male person is exposed to a hot environment, for specific, those who are driving diesel vehicle, which are old, those who are, their occupation is to stay in a hot environment, like what I can call cooks. Those who are in the Juakali sector, they are exposed to hot environment. And one key factor are those who are in border sector. The boda riders, most of them place their motorbikes in hot sun, and the motorbike, especially the seat of the motorbike, get warmed, and I can use the word get hot. And when they sit on this hot seat, the hot heat destroys the spermatozoa. So the spermatozoa which are killed, make this person to have low libido. And if you are keen and if you have any interest, try to interview as many as boda riders who always place their motorbikes on a hot sun, especially those who are above 40 and above. They will tell you, in fact, out of 10, 8 experience a degree of low libido. Low libido, if I don't forget, I may forget, is that there may be a degree. Somebody may just not feel the urge at all. Some feel the urge. Some may start the journey. What I may call, they can't perform sexual performance satisfactorily. Some get what I can call configuratorily muscle pull. Some start the journey doesn't end. And so it is the degree, there is a degree of low libido. It varies from one person to another, from one day to another. Each day may be better than the other day. So other things which may lower the hormone are medication. We have some normal medical drugs we use for our health conditions. This also suppress the hormone. The condition which even these drugs are used for also suppress the hormone. In other words, we have some medical conditions which, when an individual has, suppresses the hormone, like what we call diabetes mellitus. When somebody has diabetic mellitus, there is a time they are in crisis, and when they are in crisis, the hormone, testosterone hormone, goes down. When it goes down, these people get difficulty in this. Or another aspect is alcohol consumption. Others I can call hard drugs, use of drugs. In fact, in summary, let me just say that don't use a drug for no good reason. Anytime you are taking a drug, there should be a reason. There should be a medical condition you are taking. Taking alcohol, personally, I may be biased to that. Taking alcohol may not be very good. When you take alcohol for long, there is how it is going to affect you, suppresses the nerve, suppresses the liver function, and this thing end up suppressing the hormone formation in your body system. There may be a number of other factors. What I should not forget is contraceptive. One of the contraceptive which I'm certain about is what we call Depo. When somebody uses Depo, it suppresses hormone. And I know you may be asking, do men use Depo? Yes, some men illegally use Depo. And I've also mentioned Depo because maybe I will not get time to talk about female low libido. So for the sake of that, since I may not get time, ladies, when you use contraceptive, you won't feel the urge to have sex with your partner, and that may interfere with your family. So in case it is happening, please note that it is the contraceptive you are using. The third factor which contributes to low libido in men is physical strain, or physical pain, or physical fatigue. The physical strain, the physical pain, the fatigue also precipitate low libido. And we advise people to moderate what they are doing or suspend the game. If what you are doing is what brings you income to keep your family, so find how to balance, because during your physical activity which precipitates pain, note that there will be element of low libido. So you are requested to balance this. Lack of sleep is another factor. And what I should not forget is that aspect of exhaustive work. Balance your work because you know your partner need you. So balance your work to ensure that you don't do a work until now your domestic responsibility suffers. And the last one is that some of these factors may be combined. It may not be just one factor which has precipitated low libido in you. There may be a number of them. The psychological factor might have been precipitated by a physical strain. This thing may be combined, what I call elective. In other words, a few I've mentioned is psychological and physical, and the hormonal may be all there. So it may be rare to find that it is just one. One thing which passes and almost everywhere, the aspect of psychological is always accompanying almost the rest. Let me not forget this, that once a man had a low libido and he never performed as per his expectation, this person will have anxiety, excess anxiety, not just anxiety. He may think that the next time he's going to try again, he's going to fail, and this may worsen the situation. So I'm talking to ladies. Ladies who are listening to this, please note that this problem is common. It may not be your partner alone. I've said 6 out of 10 men, based on their age, may be feeling element of low libido. And I feel that the female partner has a responsibility of reassuring this guy to lessen the anxiety. Don't worsen the situation thinking that this guy with low libido has an affair somewhere. Maybe he has, or maybe he doesn't have. But in case you experience this in your family, please give it a benefit of doubt that it is not an issue of having somebody somewhere, but it is a problem which is with us. How do we manage low libido? I've said what precipitates low libido. Now I'm saying how do we control to make it better. One, it needs your partner support. The female partner must come in and reassure the husband that all will be well. Two, avoid hot environment. If your occupation needs you to be in a hot environment, look for an alternative occupation. Or if you are a motorbike rider, please ensure that your motorbike is ever covered under a saddle. Don't put it in the direct sunlight, because direct sunlight will leave heat, and heat will bring a problem. It is advisable for all men, all active men, to bathe with cold water, to avoid hot environment like kitchen, to ensure that each evening or every time they bathe, they use cold water, not hot water. Use of your laptop on your laps also has been recorded as one of the precipitating factor because of that heat. Or any environment which is hot should be avoided. Two, any medication which may be precipitating low libido should be avoided, and use alternative medicine. We have a number of conditions, health conditions, which need us to take some medication. This medication, I've said, sometimes precipitate low libido. And now I'm telling you, in your process of managing the condition where you are using that drug, please kindly look for an alternative drug. People think that when you use herbal medicine, then you are not wise. Sometimes it will force you to look for the right herbal to manage your condition, because of the drug, conventional medicine which is in use is actually lowering your libido. suppressing your testosterone. So use alternative medicine. For contraceptive for ladies, please use an alternative contraceptive. We have even natural contraceptive. Look for that. There is a time which needs psychological support, what I call psychotherapy. There is need for counseling. There is need for family support, and particularly your partner support. Very key. All that I've mentioned, what I'm forgetting to say, sorry for that, is nutritional. One, eat good, what I call good nutrition, high fruits, high vegetable, less fats, less sugar, less salt, moderate proteins. I almost forgot that. And lastly, exercise. In summary, non-communicable diseases are managed by one, regular exercise. Regardless of which kind of non-communicable disease, regular exercise. Two, good nutrition. And in this case, I'm saying the same. Increase your vegetable intake, increase your fruits intake, reduce fatty diet, reduce sugar, reduce salt. Take plenty of water and pray. May God bless you. Thank you for listening. Let's meet again next time we talk about another non-communicable disease.